Was she in shock?
What
Pale
kind of
cooling
shock?
clammy?
Huh?
I said pale cooling clammy indicates she was in shock.
What kind of shock?
Hypovolemic.
Okay. Which means,
A loss of blood volume.
okay. We use the terms interchangeably. As the book says, hypovolemic does refer to low blood volume. But usually, if they have low blood volume, they're bleeding out. We call that usually hemorrhagic shock because they're bleeding. And we usually say someone that has low volume, like not drinking enough water, they're dehydrated, we call that hypovolemic. But it's all of them are correct. Now you have like hypovolemic, hemorrhagic, and non-hemorrhagic. But no, you could use hypovolemic, either one. Hemorrhagic is more specifically losing out blood. They're bleeding out. Okay. So yeah, that's exactly what was wrong with her. She had severe vaginal bleeding, and so she became hypovolemic. Well, hemorrhagic, but she was in shock. We'll talk about the treatment of shock, because once we're able to get you back into the school and we get into trauma, we'll talk about taking care of bleeding. And that care, which is for shock, is standard, and you need to commit that to memory. Okay. Yeah, we're not going to cover all that stuff. So I'm doing this because of the different types of shock, and I want you to make sure you guys are able to understand it. Okay. Again, you have access to the PowerPoints through My Brady Lab, but also be taking notes because shock is a big chapter. And so now that it's been introduced, it's fair game. And you have to understand what's happening. And I'm going to give you a definition in a little bit that kind of puts it all together. Okay. All right. So EMTs, Natalie and Hannah, are responding to the report of chest pain along with the crew from Engine 9. Their general impression is of a man in his 50s who is sitting in a recliner. His hands are on his chest and in apparent distress. He is pale and extremely sweaty. So, is there anything that's jumping out at you right now?
The fact that he's pale and sweaty.
Okay, so that's a big one. What else?
His hand.
His what?
His hand placement.
His hand placement. Okay, his hand on his chest. To me, what also jumps out is his age. So that to me is like, oh, okay, I think I know what it might be. So I'm going to start thinking about that. Sitting in a recliner, not really. But yeah, his age, clutching his chest, and his skins, something is going on. So the EMTs confirm a chief complaint of chest pain and continue their assessment as they begin treatment. Natalie is immediately concerned with a weak, rapid radial pulse and labored respirations. What does labored respirations mean?
Hard of breathing.
Yeah, he's struggling to breathe. He's working to breathe. So something is causing him to not be able to breathe adequately and to raise his pulse rate. We kind of discussed the significance of it. But what is your thought on it? What is your thought on the significance of his vitals?
Low blood pressure.
Mm, okay. But I think you're putting something in there that's not there. Heart failure, possibly. I don't want to diagnose this. I just want to know what's the significance of those vitals.
Bad perfusion of oxygen.
Why? See, again, you're getting into diagnosis.
Oh, well, you said why, so he's breathing too fast, so he's not really pouring a lot of oxygen in. His rapid pulse, the blood's probably pumping the blood faster than it can actually get it through the aorta and ventricles. Labored respirations, he's using those auxiliary muscles, burning more energy than what's needed.
Okay. See, pale heart failure, possibly they are very significant given the totality of the initial assessment. Okay. Now let me back up just a little bit. So Ray mentioned heart failure. And so I said that that's kind of more of the diagnosis. However, if we don't look at it that way, can we look at it as maybe his heart is not working properly for some reason? Okay. He did have chest pain. So something is going on with his heart. That's what the vital signs are telling us. Okay, what could explain the weak radial pulse and labored respirations? The same thing. The heart is not working properly. So we haven't covered cardiac emergencies. That's coming up next week. What should you do to manage this patient? What do you think? Any ideas? Any thoughts?
High flow oxygen.
No. No. We don't do high flow oxygen anymore for chest pain. Easiest way to kill a patient.
Provide medications.
Remember, nationally speaking, we don't provide anything. The patient has to provide them for us. Have the patient rest, assist them with whatever they need, and you'll assist them to the gurney. Don't make them work. But this is going to make more sense next week when we cover cardiac emergencies. Oh, I went too far. All right. So we're going to review a little bit of chapter 8 in this chapter. Pathophysiology. Remember we talked about perfusion in chapter 8. What is that definition of perfusion? Flashcards. Perfusion, the body's ability to deliver oxygen to the tissue. So we need to have the body intact. If it works, or if this helps, remember, air goes in and out, blood goes round and round. Any deviation thereof needs to be fixed. And so in shock, we kind of have maybe a combination of both. Something is happening that we're not getting the end product to where it needs to be. And that's what shock is. Or an easier way to think about it is hypoperfusion. If the body is not getting what it needs, it's going to deteriorate. It's going to say, you know what? F you. I mean, that's real gradual. That's later on. What the hell? Fuck, man. Holy fuck. All right. Anyway, the way to think about it is hyperperfusion. And I don't know if I already said that. Hyperperfusion is another term for shock. So if there's not enough blood oxygen getting to the patient, we call that hyperperfusion, or we could also call it shock. Okay. So in the chat, I'm going to put down, I want to say a better definition for shock, but it might not be. But it's a definition that I learned. It makes it easier to understand, comprehend, I think. So shock, if I could type. Ooh. Shock. Fudge. Okay, I don't want to do this no more. The rapid and progressive deterioration of vital body function brought on by inadequate tissue perfusion. Anyway, so the definition of shock: the rapid and progressive deterioration of vital body function brought on by inadequate tissue perfusion. And actually, I forgot to put of oxygen. If the body is not getting what it needs. Then it's going to start deteriorating. It needs that oxygen. Remember that the body's going to do what it can to take care of itself. Okay? It's going to do what it can to take care of itself. And so when the body goes into shock, you're going to start seeing those changes. The body trying to take care of itself. Okay? Now, really, what we have to do as EMS providers is try to give the body what it needs. In some instances, yes, oxygen is what is needed. And in other situations, no, that's not what it's needed. For the most part, it is. Actually, rephrase that. In some instances, some oxygen might be necessary. In others, a lot of oxygen might be necessary. Because is it not oxygen that the body is requiring? Yeah. So let's see what we can do. Now, there's other things also that might need to happen depending on the condition. But a lot of it stems from the body is needing that oxygen. Okay. So if you remember, we have glucose that we get through eating, and then we get the oxygen through breathing, and it gets into the cells, and we have energy production in the cells, and the body is ready to go. However, in this case, there's not a lot of oxygen to help that sugar. And so the body is struggling to meet that demand. The other thing too is, if there's not a lot of perfusion, how well are we able to remove that carbon dioxide? Not very well, right? So it lingers. So all of a sudden I can't catch my breath for whatever reason. I'm starting to breathe inadequately. So what's going to start to happen? I know what's going to happen. Y'all are going to let me die. The morning class wants me to die too.
Does that mean we get a pass?
No, just like that, they get fails. They were hoping for A's also. I told them. Come on, be assertive. You guys are future EMTs. Take charge. You know, the saddest thing I hear is when employees of companies in this county say they wouldn't trust their coworkers to work on their loved ones, on their family members. Come on, tell me, what's gonna happen? This is all review. If I'm not getting enough air inside my body, what happens?
You're eventually gonna go hypoxic.
Okay, and what does that mean?
Cells are not gonna create enough energy.
You change from anaerobic, yeah, what is it?
Aerobic to anaerobic.
Okay,
The pyruvic acid is gonna turn to lactic acid.
okay. And what waste?
CO2.
CO2 starts to build up.
Yes, sir.
And so as a result, what happens to the cell membranes?
They start to deteriorate, eventually die.
Mm-hmm. The cell membranes start to get weaker. It's like if you see the medieval movies where they start throwing rocks or start ramming the door with a log. They're weakening those walls. They're weakening that drawbridge or the gate until eventually it breaks down and the invaders get inside. Well, that's what the carbon dioxide is doing. It's weakening that wall. However, instead of them coming in, the contents of the cell is coming out. It blew up. So let me give you a better example. I have a water balloon. But to make it interesting, it's full of urine. And I hold it over your head. And I take a pin and I begin to puncture, weaken the integrity of that balloon. What's going to happen?
Sure.
And
Spill all over your head.
not my head, your head.
Our heads.
Okay.
Yeah, I'm the one that's pulling over your head and puncturing it. The reason I used urine is because it's leaking out bad stuff, lysosomes that break down the neighboring cells. Okay. And so we have one dead cell and then another dead cell and another dead cell. And before you know it, you got hundreds and thousands of dead cells. And then the cells make up tissues and tissues make up organs and organs make up systems. So it's a cascading effect. Okay. But all is not lost. What we can do is we can kind of back up the effects a little bit, because what is it that the body is craving for?
Oxygen.
Oxygen.
Yeah, it's craving oxygen. And so that's where we as EMTs come in, and we can establish, we can give some of that oxygen to let the body be able to meet its needs. Okay. Oh, let's see. All right. So etiology just means what produces it or what causes it. So etiology is a shock. So remember I told you guys, if you're losing blood, what are you losing?
Oxygen.
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 It's a inverse relationship there. Well, not an inverse. It's not an inverse relationship. If you lose blood, you're losing oxygen because oxygen is transported in the blood. However, if you lose oxygen, you're not necessarily losing blood.
You're
Okay?
losing volume.
You're losing volume. No. Wait, how?
Blood volume.
Yeah, but I just am simplifying it for you guys. Now, if you guys can remember, if you're losing volume, you're losing blood. I mean, you're losing oxygen. But volume can be water.
Right, from like dehydration or something, right?
Yeah,
Diarrhea.
yeah. But I'm not there yet. I just want people to understand the basic concept. If you lose blood, you lose oxygen because blood transports that oxygen to where it needs to go. Because without the blood, oxygen is not going to get to where it needs to go. Okay.
Okay.
All right. So the first reason would be if there's not enough volume, if there's not enough blood available to be sent to where it needs to go. Right? I slashed my wrist. I'm losing volume. So is there a possibility I'm going to go into shock? Rapid and progressive degeneration of vital body function brought on by the inadequate tissue perfusion of oxygen. Yeah.
Yes.
And eventually, I'm going to be dead because good news and bad news are bleeding. So shock can be caused by not enough volume. Another reason would be because the heart itself is not working properly. And then the last one, inadequate vessel tone. It's the blood vessels. So they're doing something. And we talked about it in chapter 14. Yeah, pharmacology, we talked about it then. In other words, the blood vessels, they're not constricting or dilating, or maybe they're too dilated. Or even too constricted. Okay. So we talked about preload back in chapter 8, did we not? Okay. So someone other than Steve and Jesus and Raymond, or Ramon and Raymond, what is preload? Or Jacob, no Jacob either.
It's the available blood to be sent out.
Yeah. Preload is the amount of blood that's available to be sent out to the body. So if we're losing blood, are we losing available blood to be sent out? Okay. Now, because of that decreased preload, we just said that there's not enough blood to be pushed out. So what happens to that cardiac output? It's right in front of you guys.
Goes down.
Decreases.
Thank you. It goes down. It goes down. Now, if there's not a lot of preload, and we talked about the decreased cardiac output, how much stretch is on the arteries?
Not a lot.
Not a lot. And so because there's not a lot of stretch in the arteries, what happens to your blood pressure?
It goes down.
Goes down. Yeah, it goes down. It goes down. Because what tells us that the blood pressure is going to go down?
The output.
Huh?
The cardiac output.
No.
Pressure.
What was that?
The blood pressure.
Well, we already know the blood pressure drops, but why does it drop?
Because there's no blood to push.
Why?
Because you have an adequate volume.
No. We already know that. We already established that. But why did the blood pressure drop? Something tells us why the blood pressure dropped.
Reword it again, Lou.
Huh?
Can you reword it again? Or rephrase your question?
What is causing, other than decreased volume, what is causing the blood pressure to drop?
Wouldn't it just be the absence of blood?
There's blood.
The force of the contraction?
What was that?
Would it be the force of the contraction of the heart?
Somebody else was saying something.
Oh, the parasympathetic nervous system?
No. All right. What about the force of the contraction of the heart?
Well, with a decrease in elasticity, the heart can't contract as well, correct?
I wouldn't necessarily say it can't contract as well, but you're on the right track. But there's something I'm looking for specifically.
Is it
Would it be
because
Starling's Law?
What was that?
Starling's Law?
Starling's law. Yes, and Starling's law says what?
The greater the stretch, the greater the force of the contraction.
Thank you. Starling's law says the greater the stretch, the greater the force of the contraction. So if we don't have enough stretch, not enough volume, the force of the contraction is not going to be as strong. The blood pressure drops. You remember that from chapter 8?
Yes.
So that's what I was looking for. That's why we have a decrease in the blood pressure, because we don't have enough stretch. Think about it. If you go to a concert and there's hardly anyone there, are you can get all crunched up and be very uncomfortable? No. Now you have a very popular concert, whoever it is that you like, and it's sold out. Is there going to be a lot of people there? And everybody trying to get there, especially trying to get up to the front. Are you going to be like getting crushed?
Yes.
Yeah. And so think about it that way. And remember what I said about, although this is more of the loss in vascular tone, but remember that's why we worry about nitro and the little blue happy pill that Gabe takes. Oh, sorry, Gabe, HIPAA, I forgot. That was supposed to be in confidence.
Yeah, come on, Lou.
See, that's what happens when you call me out.
did him dirty?
Of course.
So you make lies?
Yeah. You want to talk about lies and cheating? You're a Democrat, aren't you? Only way to win.
No, I'm a millennial. Get it right.
So anyway, so it's that drop in blood pressure that is gonna not get blood to where it needs to go. Remember that the heart has to work against gravity also to feed the brain. So there's not a lot of push behind the blood flow trying to go up to the head, to the brain, then the person will suffer some bad things as a result. So, all right. So we know about losing blood. But somebody had mentioned it earlier. It's not just blood though, it is volume. And remember I was talking about that. So somebody had mentioned diarrhea. Diarrhea, you can become dehydrated because you're losing volume. Same thing with vomiting. Same thing with vomiting. Getting drunk. Why do you have a hangover?
Because you're dehydrated.
Exactly. You're also, man, somebody answered pretty quick. It's also because of the formaldehyde buildup in your body, but yeah, you become dehydrated. And why did you become dehydrated?
Because alcohol's a diuretic.
No, it's not.
Excessive urination.
Yeah, you get excessive urination, but it's not because alcohol is a diuretic. Alcohol is a depressant. It affects the central nervous system. And in the brain, there's a hormone that's released, and I thought we might have talked about it. No, we didn't. Called ADH, antidiuretic hormone. And so alcohol numbs the brain, and it inhibits the release of that hormone, ADH. Without ADH, you would literally pee yourself to death. What it does is it prevents you from peeing yourself to death. It keeps fluid inside. And so when you drink alcohol, now you're not releasing that hormone and your bladder becomes relaxed and you start to pee. So a diuretic, like there's a diuretic called Lasix or furosemide. That's the brand name, furosemide. It's what they call a loop diuretic. It affects the loop of Henle. And I know you guys don't need to know that. I'm just telling you. And what it does is it inhibits the reuptake of water. It's basically saying, hey, water, you can't go back into the system. So it travels down the ureter into the bladder and it builds up. And I think I told you guys, when the bladder reaches about 250 cc's, that's when we get the urge to go to the bathroom, to pee. So. So, yeah, it's not considered diuretic. It's because it inhibits the release of ADH, antidiuretic hormone. All right. Increased capillary leakage. Remember that when we talk about allergic reactions. Okay. Remember that when we talk about allergic reactions.
What did you say? Increased capillary what?
Leakage.
Leakage.
Right there. Last one. Nonetheless. Hola, mi chiquita. Hola, mi chiquita. Viente, viente. Somebody's making an appearance. All right. That's exactly what we've been talking about. All right. So any questions in inadequate volume? No? Okay. So the next one is inadequate pump function. Remember in lifespan development, we talked about the changes in the body as we get older. So what starts happening to the heart? Yeah. What starts happening to the heart?
It gets weak.
It gets weak. Okay. the arteries start to harden. So if the ventricles are starting to get weak, then what happens to that cardiac output?
It drops.
Drops.
It starts to go down. Not enough blood is getting pushed out. Here's the problem with that. We start having blood backing up. The blood that's coming into the left ventricle, where's that coming from? Yeah, somebody said lungs. I was hoping you'd say the left atrium first, and then I was going to say, and then from there. But yeah, it's the lungs. And so really, what are we going to develop?
Blood clots.
No.
Congestive heart failure.
Don't tease me like that. What does congestive heart failure mean?
Does it mean a heart attack?
No. But a heart attack can cause congestive heart failure.
That the heart is not working correctly?
To build up a fluid.
Not necessarily. Not necessarily. But yeah, I think it was Rakisha. Were you the one that said that?
I said the heart is not working correctly.
Yeah, that's what I meant. After I said, I'm like, oh wait, no, it wasn't that comment. It was the one before. But yeah, the heart is not working correctly. Congestive heart failure is where the ventricle is not strong enough anymore to push the blood out. And so blood starts to back up first in the left ventricle, but it backs it up into the left atrium and it backs it up into the lungs because not all of it is getting pushed out. So and so it starts to build up. Yes, left-sided CHF is where you have fluid buildup in the lungs. And so they're literally drowning. Well, not necessarily an end result, but yeah, it's what we call pulmonary edema. Okay. Simple term, it's fluid in the lungs because of the backup of blood into the lungs. Okay. And so now we have a person that has a hard time breathing. Now, somebody said heart attack. I think it was Candace said heart attack. And CHF can be caused by a heart attack, or CHF can be caused by age or heart disease. There are some young people that have CHF, although they also weigh like 300-400 pounds. Because of the obesity, it puts a lot of strain on the heart, and eventually the heart weakens and it can't no longer do its function. The heart attack causing CHF, that's exactly what happened to my dad. He had a heart attack, and that damaged his heart so much that it wasn't effective anymore at pushing out all the blood. And so it started it back up into his lungs. And I won't talk more about it because it really fucking irritates me. The doctor's a dumbass. Fucking foreign trained doctor. Anyway, I digress. Now, I won't get more into the right-sided one because we're not there yet. But just, again, if the heart is not working properly, then we don't have a lot of fluid, blood, oxygen getting delivered to where it needs to go. So can you see the problem there?
Yes.
Okay. And so lack of perfusion. Lack of perfusion. So here's what we were talking about. Myocardial infarction or heart failure or mechanical obstruction to blood flow. And we're going to talk about those. Wait, we kind of did, didn't we? VQ mismatch? When we talked about pathophysiology? Or am I hallucinating?
I think you're hallucinating.
We didn't talk about VQ mismatch, ventilation and perfusion. I don't have my book here, but I could have sworn I drew on somebody's book and I showed them, look, if you have a blockage here, like a blood clot, you're still getting oxygen. It's just the blood flow is not going through to pick up that oxygen. Or if you have a foreign body airway obstruction, you're not getting any air, but the blood flow is still going through the capillaries.
Yeah, you did.
Okay.
I don't remember.
Yeah, I thought it was with you. So. All right. So you kind of think about that VQ mismatch. There's something going on that's preventing blood flow from going. It's a pump issue. Now there's two conditions that will cause that or may cause that. Or actually will. The first one is a pericardial tamponade. In other words, there's a sac around the heart. And for whatever reason, there's a hole in the heart. And so blood is leaking out and it's getting trapped within the sac of the heart, the pericardial sac. And so normally we have the heart that's beating and it's gliding like this, and it's gliding with every heartbeat. But with the buildup of fluid that's pushing, and the pericardial sac is not going to expand very much. Eventually, what's going to happen is that it starts putting pressure against the heart. So now, how adequate is the pumping of the heart?
It decreases.
Yeah, it's ineffective. And so again, we go to not enough blood getting pushed out. So if there's pressure against the heart's not going to be able to do its job adequately. And that's kind of what happens with the tension pneumothorax as well, is if there is a hole into the chest cavity, it actually doesn't even have to be a hole into the chest cavity. There could be something else that caused the lung inside to pop just because. And the lungs also, if you remember, it's also enclosed in the pleura, the visceral pleura. So same thing. Here's the lung as it expands, goes against that sac. And so with a pneumothorax, we have air leaking and it collapses the lung. So a plano pneumothorax is a collapsed lung because air was leaking and it caused it to not pop, but collapse. The pressure built up and it collapsed it. Now, for whatever reason, all of a sudden, air is leaking out even more and it's getting trapped inside. And you could also have a hole in the side of your chest or in front of your chest, whatever, that's letting air in. And as the person breathes, they bring in more and more air. And so that pressure builds up and it builds up and it builds up. Think about that balloon. If you saw my fingers, my hands getting bigger and blows up. So what is it doing inside the chest cavity?
Squeezing down on the lungs.
Well, the lungs already collapsed.
Putting pressure on everything.
And doing what? You're right. It's putting pressure, but there's something else. And this is the way you know is that it is that next point there, a tension pneumothorax. Someone saying pushing against the heart. Okay. But there's something else. Do you remember chapter 13, patient assessment? We start at the head, right? And then we work down to the neck. What are we looking for at the neck?
Jugular vein distension.
And
A deviated I don't remember there. It's a deviation. Aside from a carotid pulse,
It's not going to affect the carotid pulse. Yeah, Ramon got it. You're looking for tracheal deviation. In other words, that trachea is getting shifted away from the side of the pressure. The pressure is so great that it's literally shoving organs out of the way, away from it. And so that is why we look at the neck. We look for JVD and we look for tracheal deviation. Remember that? I know I mentioned it. We can go back to the video and take a look at it.
at a senior moment, I forgot the word trachea.
Yeah, I'm probably older than you, so zip it. How old are you, Steve?
I'll be 50 in January.
Okay, you got me beat. You got me beat by a year. What day in January?
27th. Same day Mozart was born.
Well, I got better people that were born on my birthday.
Who, Mick Jagger?
Nope. Dolly Parton, Robert Palmer, Robert E. Lee.
The Confederate.
So? Still my hero.
Just saying.
Anyway. So yeah, the pressure building up is shifting everything off to the side. Now let's go back to the heart, as somebody was saying and as we were mentioning earlier. That pressure is also put on the heart. And we already talked about what happens when there's pressure against the heart. How effective is that pumping?
It's not.
It's not very effective. It's not very effective at all. And so really, it talks about giving fluids can worsen the condition.
Yes.
You're just causing the heart to work harder and not do anything. You're increasing the oxygen demand of the heart, and that could actually be detrimental. That's just what we call it. Oxygen demand, increasing the oxygen demand. You're making the heart work harder to do its job. It's kind of like if you get hurt at work, and I'm your boss, I'm like, I don't care that you're hurt, get back to work. Oh, and by the way, you can't go home until you finish this task, which is folding 1,000 boxes. It's that mean boss type of thing. And then the last one is inadequate vessel tone. We talked about systemic vascular resistance, did we not? Yeah, I'm seeing some people saying yep. And so this is what happens in shock. This is what you have to understand. Is remember homeostasis. The body's going to do what it can to take care of itself because it wants to get back to that state of equilibrium, its happy place. And so we know that the body needs to take care of the brain. It's the most important organ. And so if we lose blood, what can happen to the blood vessels?
They shunt off. Maybe I didn't say it. right, but
Well, that's the effect. But normally, what is it that happens? What's going to happen? We know that as the volume drops, the pressure can go down, right?
right.
Because there's less volume. And so what the body's going to do to try to take care of itself is cause the blood vessels to shunt, but that's more of a, to divert blood away from unimportant areas. But the blood vessels are going to get smaller.
They're going to constrict.
They're going to constrict. They're going to get smaller. By having smaller or constricted blood vessels, what is the body trying to do?
Increase pressure.
Pressure.
All right. Going to try and increase the blood pressure. And that's what systemic vascular resistance is. It's a safety mechanism, so to speak, that because it's losing volume, it needs to keep the brain intact. Because without a brain, we don't have a viable person. The heart might still go, but the rest of the body's going to die. Or actually, if you keep the heart going, you can maintain the other organs perfused, but just that person is, for all intents and purposes, deceased. So the body is gonna constrict all those blood vessels to maintain that blood pressure. But here's what happens. Continue to lose blood. Eventually, the heart and the body is not going to be able to keep up with that blood loss. And we go into what they call circulatory collapse. In other words, the heart can't keep up. And so we get that circulatory collapse. So what happens to the blood pressure?
It drops.
Drops. Understand that is why hypotension or low blood pressure is a late sign of shock, because the body's doing what it can to maintain that blood pressure. When you see that blood pressure drop, the body's having a hard time keeping up. And we'll talk about what kind of shock we call that. Okay. So remember, systemic vascular resistance is the body's compensatory mechanism. It's compensating for that blood loss. So the blood vessels will constrict to maintain that blood pressure. Okay. Now, remember when we talked about the little blue happy pill and nitro? So part of the problem of that drop in pressure is just like with giving those two medications together. You've increased the size of the container, but did you increase the volume? No.
No.
And in fact, with bleeding out, we might even have less volume. And we go back to Starling's law. If there's not a lot of stretch, not a lot of force required to push that blood out, then that blood pressure is going to drop. Does that make sense? Okay. Now, there might be a reason that the blood vessels dilate. So am I on your guys' screens? Okay. So remember capillaries, it's a mesh. Arterioles go to the capillaries, and then from the capillaries we have the venules and then the veins. Okay, so here's the capillary bed. If we have vasodilation for whatever reason, allergic reactions is one of those. So we have vasodilation. And remember that term that we used at the beginning, the capillary leakage? So what happens is now with the vasodilation, those capillaries are opening up. And what starts to get out? Fluid, plasma. We have leakage of volume. So how many of you saw the movie Hitch with Will Smith? You remember what happened to him after he ate that shellfish? His face went, it swelled up. That's a result of that capillary leakage. It could happen to the face, the hands, the tongue, the lips. It also happens in the throat. It's what we call laryngoedema. Not Lorenzo edema, laryngoedema. This dictation sucks. Laryngoedema, the larynx swells up. So that's why they feel like their throat is closing, because you have fluid building up in the throat that's closing it off. Kind of neat to know that, huh? To learn that? You guys don't seem as excited as I am. Jacob's just like, wake me up when you're done.
I think it's interesting because my daughter has severe food allergies, so she is anaphylactic to certain foods. So it's interesting to know that.
Oh, good. Yeah, so that's what's happening in allergic reaction. It's just the body is over exaggerating that allergen that came in, and it just opens up, and that's why you have that. And so the reason we give epinephrine, adrenaline, is because of the effects. It's the vasoconstrictor. So now, instead of it being nice and open, it closes up. Okay. So something's happening with a vessel tone. All right. So here's the categories and types of shock. Oh my gosh, this is a lot of stuff. How am I going to do it? Let me give you guys a shortcut. Oh. Patty, is that you?
Yeah,
You're here.
I am.
Cool. Clarissa is too.
Hi, honey.
She's not answering. She's already learned the trick. You log on and then you just ignore. Anyway, here's the shortcut, guys. Docs. I'm putting it on the chat. D. distributive shock. O, obstructive. C, cardiogenic. H, hypovolemic. Now, sometimes they put S for septic, but septic is more of a distributive shock type of thing. Those are your types of shock, DOC, D-O-C-H. Oh my gosh, I can't remember that. I can't remember where anaphylaxis falls. I can't remember where pulmonary embolism falls. Guess what? We're gonna go over it. We're gonna go over it. They got metabolic respiratory also, but yeah. Distributive, obstructive, cardiogenic, hypovolemic. Oh my gosh, look at that. I think we could do this. I think we can, can't you? Yep. Chocolate. Are these the main ones we have to remember? Well, those are the categories, but then you have the different types underneath or within each type. What's the Mr. for? Metabolic respiratory?
Yes.
No. I know that's in there, but no, the main one is docs. Doc. I put septic in there, but again, it's part of distributive. So because it starts off with hypovolemic, let's talk about hypovolemic. We already did it. It's a volume issue. And again, that they say hypovolemic means low blood volume. Okay, yeah. And hemorrhaging is the most common type. We call it hemorrhagic shock. They're bleeding out. But it's not just loss of blood, it's loss of volume. So if you got diarrhea, if you've been vomiting, burns can cause dehydration because of the leaking plasma, because of the burn. So there are other things that will cause you to lose volume, either blood or water. And we already know why that is. Now, the picture on the left, there's the hemorrhagic. There's a laceration to a blood vessel. Out it goes. The picture on the right, that's the capillary leakage. Plasma is coming out because of capillary permeability. Big word. Just remember that plasma escapes through gaps in the capillaries. Is that a little bit better to understand? Simplified? Are you happy with that definition, Miss Patty?
Yes.
Okay.
Sorry. Stop.
Gotta love kids. All right, so that's hypovolemic. Okay. All right. Distributive. What does distributive sound like? Paula, what does distributive sound like? Maybe, maybe not, Ramon. Kind of, but I'm trying to get you guys to think of it. Oh. Quit. No. That's not what I'm referring to. I just want to know what distributive sounds like. Anybody have an idea?
Transport?
Okay, that's a little bit closer to what I'm thinking about. I'm thinking distribution. Sound a little bit better?
Yes.
Now, it does have to do with circulation in a lot of respects. So distributive shock is a distribution issue. Okay. So look at the first bullet point, caused by vasodilation, leading to a relative reduction in intravascular volume. So something is happening with the blood vessels that is causing the distribution of oxygen throughout the body or to certain parts of the body. If the vessel's too big, but there's no change in volume other than decrease, are we going to have a distribution issue? Inadequate blood volume transport, right?
Yeah.
Mm-hmm. Or if as the blood is going, all of a sudden the capillaries are open, we have that leakage of blood. And the answer is yes. You can come with multi-systems trauma. I'm trying to think. We'll get into more specifics in a little bit. All right, another category is cardiogenic shock. Now the suffix IC means pertaining to. And Jen, if you're not Christian, I apologize. But if you are, what book of the Bible says in the beginning?
Genesis.
Genesis. Yeah. And so the prefix or sometimes suffix, combining form, whatever, gen means origins or beginning. And then we know what cardio means, right? It means foot.
Lou, what chapter are you guys on?
Chapter 15.
Thank you.
You're welcome. Yeah, you could say beginning at the heart, but I think more correct. And Patty, somebody's saying page 441. More correct phrase would be it originates in the heart. Cardiogenic, originating in the heart. And so anything that's originating in the heart, are we going to have an issue sending blood out? Yes, we are. So something is causing the heart to not be able to pump effectively. So you see how we have the decrease in stroke volume and cardiac output. The heart's not contracting effectively, loss of volume. The heart is not able to do an adequate job. So something is originating in the heart. So for example, a heart attack could lead to cardiogenic shock because it's originating in the heart. And this is what I was referring to. Now, the reason why the person's going to get cardiogenic shock in this case is, if you remember, we have the SA node up here. You see the green? Okay. Actually, I think I'll use the highlighter. Better. Green highlighter. Okay, so we have the SA node up in here. And that impulse goes that way and that way. Eventually comes this way, right? Gets to the AV node, bundle of His, and then goes down, and then they go this way, right? Well, that electrical impulse, as it's traveling, actually, let me change the color. So as the impulse is traveling, all of a sudden, it gets to an area that has been damaged. And in a heart attack, that muscle, the heart muscle, is dead. So it's useless. And so when it gets a shock, it's like you go and shock a dead cow. What's that dead cow going to do? Get out of your way? No. And I don't mean your wives, guys. The cows. I'm just kidding, ladies. You ladies are awesome. Uh-oh. Am I in trouble? Ooh, somebody said yes. I'm just kidding. But anyway, no. But yeah, it's like, if you cattle prod something dead, are they going to react? And the answer is no. And so here comes that electrical shock. Nothing is happening. And so that impulse has to go around that area. It's not going to react to that shock. And just so you understand, when a paramedic or the nurse, the doctor, although, yeah, the nurses do get EKGs, we're looking at the squiggly line and what they do as a result of that damage. The squiggly lines will tell us and kind of tell us where. It's kind of cool. Okay. So that's what's happening. And so this is why, if the heart attack is more on this side over here, we're going to get CHF. Because again, that part of the heart muscle is no longer working. So what happens to that blood flow? It goes down. It goes down. Okay. Questions on distributive or cardiogenic? Okay, so next one is obstructive. I wonder what that sounds like. Anybody?
Like a block?
Yeah. Although I'd rather you guys use the word that you have there.
Obstruction.
Yeah, an obstruction. So the way to think about obstructive shock is that there is an obstruction. There's some sort of obstruction. Basically, something is interrupting the blood flow. There's a roadblock. There's an obstruction. So obstructive shock, there's some sort of obstruction that prevents the blood from continuing on. And so an example would be a pulmonary embolism, a blood clot in the lung. Because where's that clot? Is it in the alveoli or is it in the capillary bed or in the bloodstream? Anybody? It's in the bloodstream because it's circulation. So pulmonary embolism is a blood clot in the lungs, which is specifically in the bloodstream. And so that blood is not able to get past that blockage, that obstruction. So is the blood going to pick up any oxygen? No, because there's no blood flow to pick up oxygen. Can you see the problem with the PE? And then the other two, as we mentioned earlier, cardiac tamponade or pericardial tamponade and tension pneumothorax. Is ejection of blood from the heart being obstructed in some manner? Okay, Jesus is saying yes. And why, excuse me, why is that? Okay, rephrase. Why is blood not getting pushed out of the heart? Or why is not enough blood getting pushed out of the heart? And either one, either the tension or the pericardial tamponade. Okay, how is it obstructed? We know it's obstructive shock. So how is it obstructed? All right, because of the pressure being placed on it. It's pushing it, so the heart is working against that resistance. And it's having a hard time. It's having a hard time. So obstructive, there's an obstruction that's reducing the blood that's being injected by the heart. Well, that's the tension and the pericardial tamponade. With the pulmonary embolism, there's an obstruction in the blood flow that it can't get through that obstruction. So that's obstructive shock. So here you go, pulmonary embolism. You notice the clot over here on the far left. Right, oh, fudge. So you see the clot right over here. Whereas you notice with the tension pneumothorax, look at all that space in there. That's air that is getting trapped, but because the air that's leaking out from the hole, that pressure is building up and it's pushing against the heart. And you also see how the trachea goes straight and then it deviates away from the affected side. And here we have the pericardial sac, and it's putting pressure. We have the leakage here, and so there's pressure on the ventricles. All right. Yeah, I'm not worried about that one. So, timeout. I don't know how to say it. I'm at a loss for words. I guess the question is, how do you want me? I guess it's not just today, but for the future. Although I shouldn't have to be doing this. Do I need to lecture to you guys like you haven't read the book, or should I lecture like you have read the book?
Like we've read it.
So I should lecture like you've read the book?
What does that mean?
What does what mean?
What do you mean lecture like we've read it? Like ask questions before you explain it?
No, lecturing like you haven't read it is just, I don't ask you guys a lot of questions. I just ramble on and on and on and on. Whereas lecturing like you've read it, I just ask you questions.
Well, in the beginning, you suggested us to read it so we can discuss it during lecture.
Yeah, but that doesn't seem to be very popular. Because I'm telling you, shock is a big deal. Shock has a high failure rate. And you could ask the people that took Life's program. Usually this was the third or fourth exam they failed. And so at that point, you couldn't fail anymore because they only let you fail 4 exams before they drop you. I don't do that, at least not to you guys. But shock is a big deal. Shock's a really big deal.
Lou, I have a question.
Yes, ma'am.
For your exam, you know how like it gives like percentages of each like category you're gonna be asking? What is the percentages of that, like the topics? That's right. I don't know if I'm asking.
On the module exams?
No, on your like final.
On the final, it's on combat veteran. So it pretty much covers every single chapter. I don't know what the breakdown is though.
Oh, okay.
But basically I choose every single topic.
All right. Thank you.
And really, that's why I review the exams with you guys, to show you why the answer was what it was. And as you noticed, like that OPA and NPA question, you know, we talked about how it didn't say anything about the patient having gag reflex. I know the reality is that's what we do. We're going to start off with an OPA and find out. But on a written question, remember, the thing about these tests, and really the thing about registry, it's not, can you remember DOCS or DOC, DOCH, distributed obstructive cardiogenic hypovolemic? It really is not that. It's when you're given a situation, can you think through that problem and come up with a solution? So they're not going to ask you, which of the following is not one of the chambers of the heart? That's basic recall. And that's the way we used to teach. And we found out that students were not successful with the registry because we were teaching you wrong. This is exactly why I ask you why. I want you to explain your answer. I want to know that you know why you chose that answer. Like I had in the morning class, they gave me an answer. And I said, okay, you're telling me it's that. Now convince me why that's the answer. He couldn't. I mean, he gave me the wrong answer. And that's probably why he couldn't defend his answer. To think about a question, and this is why I tell you the little rules, because they do come into play. Trust me, ask any of my former students that have taken registry. They'll tell you that the rules apply. That's why I have them. You have a patient, whatever the scenario is. You have a patient. What would you do next? Would you take vital signs? Would you put them on 15 liters of a non-rebreather? Would you suction the airway? Or would you check a pulse? What's the answer? That's analyzing the question. So what's the answer?
Check the pulse.
I heard check the pulse. Everybody agree with them? Speak up.
Yes.
What's the ABC rule?
Airway, breathing, and circulation. Airway,
Okay.
breathing, and circulation.
And there's more to it than just ABCs.
The heart rate, the rhythm.
The ABC rule. You always, always, always do the ABCs first in that order. And you can't move on to the next step until you've cleared the previous step. However, there are two exceptions to the ABC rule. C-spine and stop the bleeding process. Vital signs don't come into play till after the ABCs. Oxygen, that's part of breathing. Pulse, that's part of circulation. Suction, that's part of airway. Well, guess what? Airway comes first. And there's no exceptions there, so guess what? It's suction the airway. The trick to be able to answer those questions is understanding all this stuff. I'm just writing on something. What I'm trying to do is a method called the flipped classroom. And what that does, it puts the responsibility on you. Because we know, and being an experienced instructor, I know that what students do is they're like, oh, I don't have to read, I don't have to study because the professor is going to go over the PowerPoint and tell us what we need to know. I mean, when you first start out, you're excited, you're eager, you read the book, you highlight, you do all that stuff. And then later on, it's like, why am I going through all this when the professor's just going to lecture and tell us what we need to know? Okay, that's really not very beneficial. What the flipped classroom does is it puts it on you, where you have to be prepared. So when you come to class, you're able to do things. And actually, I got an idea. So let me do this first. I shouldn't do this, but what the hell? Oh, it doesn't like that. All right. It does not like me. All right. It does not like me. All right, so I guess I'll read it to you guys. All right. So this is one that's gonna cause you to think, okay? Yes, Miss Marisol.
No, nothing. Sorry.
Okay. All right. A patient with a severe GI bleed is in shock. Which ALS or hospital intervention would best correct the patient's underlying problem? Now, I know it says ALS or hospital, and we're EMTs here. However, understand what they want you to do. So, what do they need to do? High concentration oxygen via an ET tube, intravenous fluids, replacement of lost electrolytes by IV infusion, or blood replacement.
Blood replacement.
Yeah, I would go with blood replacement.
I agree with that too.
Okay, why do you guys say blood replacement?
Because he's losing hemoglobin when he's bleeding.
Will you repeat your question, please?
A patient with severe GI bleeding is in shock. Which ALS or hospital or intervention would be best correct for the patient's underlying problem? High concentration oxygen via an ET tube, IV fluids, replacement of lost electrolytes by IV infusion, or blood replacement?
Well, as EMS scope of practice, we could only administer high flow oxygen. We can't do intravenous anything.
But remember, I said, I know as EMTs, we're limited as we can do, but the question is saying, really, what does this patient need?
Well, he needs blood replacement if he's bleeding out.
Yeah, that's really the definitive treatment. And it doesn't matter what it is. What is shock?
Hi, Patty.
A loss of the body's ability to maintain hemostasis.
Homeostasis.
Homeostasis, I'm sorry.
The rapid and progressive degeneration of out-of-body function brought on by inadequate tissue perfusion of oxygen. Really, yeah, hyperperfusion. But again, the rapid and progressive degeneration of out-of-body function brought on by inadequate tissue perfusion of oxygen. I learned that definition 21 years ago. In paramedic school. The body is not getting enough oxygen. And somebody mentioned the hemoglobin. Isn't that what the body's needing? Blood to be able to transport more oxygen?
Yes.
Yeah. And so that's why that answer would be, or it would be that. All right. When a person is in shock, what is occurring in the body? Is it the cells are getting glucose and other nutrients, but no oxygen? Is it the blood carries an adequate amount of oxygen, but not enough nutrients for cell survival? Or the cells are not getting enough oxygen and waste products are accumulating? Or the last one, the amount of oxygen to the cells is adequate, but CO2 is not being eliminated.
C.
Charlie.
Okay. Can I hear from people other than Ramon and Steve and the usual suspects? How's that? Okay, I've heard from two more. Anybody else?
I don't know if you heard me, but I also said C.
I agree with C as well.
Huh?
I said I agree with C as well.
Okay. And that is correct. And that was actually in the slide, wasn't it? I love putting scenario questions on the quizzes. Have you noticed that? Have you ever wondered why I do that?
They make us think.
Thinking.
That's part of it, but there's a bigger reason why. Anybody wonder?
Is it
Trying to
because
get
these
us
are
ready for-
situations we're going to be in and like
No.
information doesn't occur in a vacuum? Okay.
Nope.
Trying to get us ready for the national.
What about the national?
This is how our knowledge is tested. Whether we understand what we're trying to fix.
Part of it is critical thinking, and yeah, the national. That's how National Register is going to test you. They give you scenario questions because that's how you analyze a problem. Because the reality is that's how oh shit, it's already late. That's how they test your ability to think and analyze, synthesize. You are going to see a lot of scenario questions on National Registry. So, method to my madness. All right, it's 8:16 now. I didn't realize the time. Take a break. Be back at 8:35. Sound good? All right.
Copy.